Good morning, everyone, and welcome to our webinar, Unlocking Retirement Benefits for Union Members. My name is Scott Raskus, and I'm the Director of Communications here at RetireeFirst. The site at the end of the presentation here. Next, we have Matt Zer. Matt is RetireeFirst Director of Member Engagement. Matt leads our team of wellness advocates in addressing gaps in care by proactively contacting retirees to educate them about carrier-sponsored programs to help promote wellness and things such as annual well visits, screenings, house calls, and much more. And under Matt's leadership, our wellness team has made a significant positive impact in addressing retiree gaps in care and really ensuring that our retirees have good health and wellness for a fulfilling retirement. Lastly, our facilitator today is Gian Richeza. As Chief Business Officer and co-founder of RetireeFirst, Gian oversees RetireeFirst's overarching business initiatives, which include developing new market segments, strategic partnerships, and company-wide organization structure. Gian's most recent strategic initiative was a really exciting one, a very recent one, which involved a long-term planning, execution, and opening of RetireeFirst West. That's our new office location in Arizona to better serve our West Coast and our Midwest-based retirees and expand the hours of accessibility to those retirees. So we're excited to have you all on board. Thank you all for joining us today. Gian, I'm going to now turn it over to you.
Great. Thank you, Scott. Welcome, everyone. We're excited about this panel today. Before we jump in, we want to get a sense of our audience a little bit and again, thank you for joining. We're going to put up a quick poll question. So, are you currently offering any programs to educate your members on their benefits? We want to remind everyone that your responses are completely anonymous. You can select yes or no, and then I'll give it some time for the answers to populate. Okay. Great. We appreciate everyone's input there. So having started there, let's jump into our panelist questions. Matt, Mike, and Carl, again, a big thank you for joining today. We know you can shed a lot of good light and give value to all of our attendees. So we're going to start off with Carl. Carl, I know we'll get into a lot of specifics during our discussion, but if we can start out at a high level, can you give a little bit of background or discuss the importance of unions in helping their active members plan for retirement early in their careers? And then on the other side of that, how the unions are also helping their retirees manage their health and wellness, once they age into retirement. Can you give us a little bit of an overview there?
Certainly. And first, I want to just say thank you for letting me be part of this. I'm very excited and certainly hope to add some good information. It's critical for unions to be involved with their members and their retirement security. We especially, and I call it the COVID disconnect, especially in the last couple of years where a lot of unions didn't see their members at the level that they're normally seeing them. People lost track of what's involved with a collective bargaining agreement, because it's not just about wages, it's about vacations and healthcare and pension and all those things are what unions are supposed to be working for, which is the old cradle to grave that the company takes care of you while you work there, but we take care of you from the day you start with the union until the day you're no longer with us. And, that's a big deal. And so, from our perspective, we work really hard at that. We are a very service-oriented organization. We have people out on the street, business agents, field reps out there talking to the members every day. And I know we'll get into this later, but, we've initiated some things in the last 12 months to try to get that connection again in place to continue to promote retirement security, benefit security, and why benefits are important. So. Yeah,
I love the word connection you use there, because, we always value communication and the education piece, but connecting with the memberships or with your membership specifically, it's such a value add that unions are helping both their active members, their retired participants. It's just, again, such a huge value add. So thank you for that. Mike, we're going to switch over to you. So you founded the Union Labor Advisory Network. Again, we know it as ULA Network. Doing great stuff over there. We appreciate everything you're putting out. Your interviews with labor professionals, the articles you're putting out there, making everyone aware of industry events. It's just also important to the labor community. So having all the background you have, can you share why unions are so special and critical to helping their membership? And again, touching on a big theme today is, the values added there. Can you give us a little bit about that?
Yes, and thank you, Gene, and appreciate the opportunity to be on this panel discussion as well today. And I think Carl touched upon a lot of the things that I would say why labor unions are so special. We talk about from cradle to grave and looking out for the best interest of their members. I founded the ULA Network as a site to support, educate, promote union labor, and what we do and serve within our communities. And Carl touched upon you're a service industry serving others in the membership, and just looking at that, for my 18 years in career, just being and working with a diverse group of different labor organizations, there's one common goal, and that is to protect and promote the rights and well-being of union members and working to improve the overall quality of life for their membership. And for me as a service provider and doing this for so long, and COVID changed my life and putting myself into this particular role to really promote and educate what a union job is all about, the benefits that you're receiving, the camaraderie, the solidarity that's there, and that common goal to really help others and make sure that people are equipped with the right benefits, education, healthcare, and some of the financial resources and tools that are there. And it just really makes me proud to be affiliated with organizations like yourself, and the diverse group of union organizations. You could learn from so many. And from, in my new role, it's really to educate and promote all these particular programs and find ways to create efficiencies to support those members. So, I feel, I'm excited to be a major labor advocate on a bigger, broader platform, and to be able to work with organizations and have conversations with Carl to say, what's working, what could be better. And looking at all the technology enhancements from the fintech world to health tech is really driving down costs in different ways. And it's how do we repurpose those savings for better benefits and member benefits, and educating the members on financial tools and workshops that can be created on platforms like this today. And this webinar today is opening up opportunities, and hopefully will educate people that have joined to spread that word, that message about what great opportunities are and lie within the labor space. So appreciate that question.
Well, it's so true. And again, likewise, we're so appreciative of what you're doing with ULA Network. Again, when it comes to resources, to educating people out there, I mean, having a place to put all that and have everything in one area, it's vital, and it's great stuff. So we appreciate that very much.
Thanks.
Going to switch back over to Carl. Carl, we mentioned the first question. We'll get into the details. Now we can actually get into some details. So in all of your history that Scott touched on earlier, can you dive into a little bit and give us some of the strategies and services you're incorporating with your health fund today for both your post-65 retirees, your Medicare population, as well as even the pre-65s. But can you touch on, what you're doing to try to help that population specifically?
So we're always doing a lot of things for our retirees. We have over 3,000 retirees, both pre-65 and post-65. We provide for the pre-65s very similar benefits that they enjoy as an active employee. For the post-65, certainly we have the Humana benefit along with their Medicare, and especially with the post-65, helping them understand that transition is a big piece. RetireeFirst is very helpful in that transition, by the way. We appreciate it. Recently we rolled out an app for all of our participants. I think we've got at this point over 1,000 people have jumped in on the app. And again, it's just another tool to continue to do. We meet with our retirees on a regular basis. We talk about the changes that are going on. We do mailings, and certainly we have a fund staff that deals with their concerns or questions or helps them with their bills. It's a full court press. I mean, it's that, again, going back to that whole service model. When I got hired 40 some years ago, I walked in every day and there was a route sheet that said, you're going to go visit 20 shops. It was like being a bakery delivery guy, and you were going to go visit every one of those shops. You were going to see the members at those shops, take care of their problems. If there was an issue, connect them with the right person. And we still live by that mentality today.
Yeah, well, thank you for that. And what you're doing, what your officers are doing, your trustees, your fund staff, like you mentioned, it's so valuable to your entire membership, but all of these different resources, again, that we're talking through, to have them readily available to engage the membership, to educate them and touch on all these things and have these, again, these resources. There's such a value to a union member having access to all that. So it's a testament to you guys and what you're doing with your fund. On that same breath, what's so important to us over the last few years and what we've been trying to bring to the market, and I believe every fund is probably trying to do this as well to curb costs, but instead of reactive health, it's proactive health outcomes. And what are we doing to help our membership? How can we get them happier? How can we get them healthier? The pros and cons there, we can go on all day. The pros are going to outweigh them. A healthier membership is going to drive down costs. It's going to be a better situation for everybody. So, Matt, thanks for your time today. Want to shift focus to you. Can you, discuss gaps in care a little bit and the importance of addressing these gaps within a retiree population and focusing on their wellness? And then furthering that, can you dive into what we're doing today to proactively address gaps in care with all the retirees we're currently servicing for? Can you kind of give us an overview of both of those areas?
Yeah, absolutely. So gaps in care really represent recommended annual doctor visits or tests that really all retirees should be receiving, and they could have missed them for various reasons, hence the name gap in care. Some of them are recommended annually for everyone. So think about an annual wellness visit. This is an enhanced, visit with your primary care physician. They go over a lot more information with you than your typical annual physical. They're looking at, your mental health aspect a little bit more, starting to get into some socioeconomic factors as well, which we know is hugely important for the health of individuals. And it just helps with care planning as well. So if you have chronic conditions, it gives more time for the visit to allow for that opportunity to talk one-on-one with your provider and sort of flush those things out and create a solid plan moving forward. And then there's gaps in care that could be related to like a maintenance of a condition. So diabetics, for example, it's recommended that they get a diabetic eye exam every year. This is to, monitor the development of diabetic retinopathy, which can lead to vision loss or blindness over time. So hugely important, as you can imagine, to close that gap, so to speak, and get that test done annually to make sure that there is no progression of that secondary disease from having diabetes. So looking at this in total, it's really critical that those folks that are, have these gaps in care, stay up to date on these tests or these visits with their doctor. And to your point, how are we handling that? You said it perfectly to say proactively outreaching, right? So it's not sitting back waiting for something to happen to a retiree or a member where they have a high cost event or they end up in the hospital. It's outreaching first before that happens to make them aware of these gaps in care, help them close the gaps. Oftentimes the teams here are calling members, doing a three-way call with their physician's office to get these tests or procedures set up. Or again, helping them navigate how they can find the provider closest to them. So it's really about us working with them one-on-one, making them aware of the gaps they may have. They may not even know that they should be getting these tests sometimes. So helping them understand that, why it's important, and then helping them close those gaps by doing that outreach, engaging with them, signing them up for these visits with their doctor, their pharmacist, their eye doctor, what have you, depending on the gap.
Love everything you said, and I'm such a fan of what we're doing with our gaps in care for all of our retired participants. And what's so nice there is we have so many great case examples of us proactively reaching out to our members, scheduling, whether it's the appointments or whatever it is, and finding that we have found something proactively that's helping them. We've heard about heart stents and different things. We have so many good examples of this outreach and the proactive approach to managing our retirees' care and making sure that they're doing what they need to do. We've seen already so many great outcomes that come out of this. So it's just such a huge benefit to a union's population or any singular retiree. It's just a huge value add for them. So that's great. Thank you for that. Mike, I want to shift back over to you now. So consistently, there's always a lot of news about, the rising cost of both retirement and healthcare costs. But the role of, the financial literacy, we're seeing a lot, specifically recently. Can you address the importance of the financial aspect of retirement planning for active members at a young age? We know that's so important. And to help them prepare financially for retirement, even when they're just starting and they're saying, oh, well, that's 30, 40 years from now. We know it's so important to them. And can you also dive into what important or what resources are available to them to help educate them on this, specifically the financial planning and the management and basically how they can live a better life in their retirement? Can you talk about what you're doing and what you have available?
Absolutely, Gene, and thank you for that question. And just to piggyback from what Matt made mention of being proactive with the healthcare and just looking at these particular gaps, being proactive and looking at your finances. You talk about, financial stress could lead to healthcare issues, obviously, because can I pay for my bills? The stress levels of all those things that come into play all compound in different ways. So having a good financial future, that less stress, understanding what your plans and goals are in the future is, imperative. And again, in today's world with financial tools, apps, automation can really help in that regards for the younger generation, that we all live off our smartphones and everything's really just embedded onto our phones today. That's, I look at my bills, what's here, this is how much money I have. I'm plugging in APIs to understand what my retiree benefits are. But before we even jump into that, I just want to give some statistical data that I believe is really important to address financial literacy and planning for retirement. A recent study in my previous employer, we talk about Lending Club, they did a paycheck to paycheck report, which was produced in collaboration with Lending Club and Payments. But in June of 2023, 61% of consumers live paycheck to paycheck. And additionally, you look at, oh, you know what, maybe I make $100,000. 100,000 or more are living, well, it was 49% of America is living paycheck to paycheck. So if you think about these things right now, it is imperative to understand and plan accordingly upfront and use those particular tools on a regular basis. And I believe it's really important to actively educate ourselves on these goals. In today's world, there's podcasts and things that you could listen to keep yourself up to date, just like you would for healthcare apps that are out there as well. And just to understand, I think Cole made mention of as well about planning for retirement and, being in a union organization and receiving all these benefits, not just your financial wages, but the overall benefits in healthcare. And all the other supplemental benefits that you get that really round out that particular benefit package. And, when you look at as a younger generation, just getting into a job, you have time, and in the time horizon as a young employee to make sure that you're setting aside a certain dollar amount, whatever it can be that you can work with, but the benefits of compounding interest and all that, money, if I could set aside just $100 away, or there's apps like Acorn or different groups that'll just take a couple and round it up and put money away for you. All these things are available to you. And, in working in collaboration with the fund administrators and the executive boards to make sure that we're educating those members on a regular, continuous basis through membership meetings or training, all that stuff comes into place. Monitoring and managing those expenses. When we were prepping for this call, I think we talked about, and it happened to me, everything's automated. Your credit cards are linked to everything that you're doing today. It's a double click and all of a sudden you got the app. But, managing your day-to-day finances is imperative too, to understand what I could put away and save for retirement for the future. You talk about like the Dunkin' Donuts app, I got $25 and all of a sudden I looked, I spent almost $3,000 in the year. I'm like, well, I got to reallocate here. And there's tools to allow you to facilitate and do that. And then really the debt management tools, because, in labor and you look across the industry, if you're in a municipality or public sector, but if you're in the building trades and or a Teamster, there may be gaps within your income and salary. And how do you manage those particular gaps? It's extremely important. And, that comes into debt consolidation. If you go out of job, and we talked about some statistics, if 60% of America is paycheck to paycheck and you go on furlough for 3 months, where's that money coming from? And you're tapping into some debt. And then once you maybe get back into the jobs, like how do you monitor that and manage that, and trying to reduce those high interest rate credit card bills or higher rate expenses, to monitor and pay those things down fast so that you can actually allocate and budget accordingly. There's a few other things here. Income replacement. We talked about one particular program, and there's so many, and I know we'll go into it towards the end of the day too, just about some other tools or resources. But there's something called the FIRE movement, which is Financial Independence, Retire Early. It was inspired by a 1992 book, Your Money or Your Life. And it really invites and challenges you to consider accumulating wealth by being satisfied with less, and just trying to monitor, do I really need that super handbag, or do I got to pay for this particular super, venti latte or wherever it is going on. But these things all come into play. And when you look at the fireside movement, they basically say the rule of 25 says you should save roughly 25 times your annual expenses to have a nest egg to draw down on indefinitely without running out of money. And if you need 60,000 per year times 25, that's 1.5 million you'll need for retirement, in addition to the other expenses that you have to be able to facilitate that. And these are some quick numbers. Obviously, a lot of different things come into play. I'm making more money now or maybe in the future, and allocating those things. But the tools that are available, and what gets me excited with the ULA platform and working in collaboration with sponsors and supporters like yourself, is to be able to collaborate, consolidate, and distribute this information on a regular basis to help for the better benefit of these members. So that's where I see some of these things, and hopefully that was helpful, Jane, in the question that you had.
Absolutely. And hearing you say the numbers, it's always eye-opening. I mean, we read this stuff and it's not hidden information, but still every time you hear it or every time you say it, it's still eye-opening. And again, what you're talking about, having the resources in one area or relying on the health fund, your union, using the resources that are available. We talk about all the time. It's creating good habits. The Dunkin' Donuts, it's sometimes, day to day you don't realize, but like you said, you look over a long period of time and it's okay. Maybe we slim back there a little bit. So it's creating good habits. It's making sure you're utilizing all the resources. And specifically for you guys, having all the resources in one place is a great thing. Now, Carl, we've had this conversation before. I know you can expand upon what Mike was talking about there. I know you're a big proponent of the financial literacy beginning early in all of your members' careers. What specific initiatives have you introduced to educate all of your members on the financial and planning management? Because again, I know that it's important to you to get to them early and to continue to have the resources available and to continue to educate them over the course of their careers. So can you expand upon what Mike was talking about and let us know what your fund is specifically doing?
Yeah, and Mike, you hit it. It's a different world out there with these actives. I mean, these young people coming in don't look at the world the way people that came into the union 20, 30 years ago look at it, and they want quality of life. They don't want to work 40 hours a week. They want to retire at early ages, and it changes the dynamic of what unions need to look at in representing their members and their retirement security. I mean, we've worked, the average retiree walks in a year or two before he retires and says, what's my pension? And then it's probably not what they thought it was going to be. Maybe it's a little bit less. And now they got to figure out, okay, I've got the cost of healthcare. I've got the cost of paying my regular bills. We've worked with folks like Mike to help not only educate them on, how they move forward and keeping that stream of income consistent with what their bills are and what their lifestyle is, but in doing things to protect their assets. Most people get to that point, I'm probably one of them, that don't put the things in place to protect their assets for their spouse or for their children or whatever the case might be. So, we've been working with different groups and with our retirees to make sure, and those people that are getting close to retirement, to make sure that they've got the tools in place to accomplish that. The actives is a whole nother animal today. And I think, as I talked earlier about the health fairs and some of the things that we're doing in the apps, we're trying to help them understand, you've got pension. In a lot of cases, pensions have gotten beaten up over the last few years. Certainly the SFA has helped a number of them out. But, people have made a lot of money, especially in a number of our shops and the Teamsters and other unions. People's income has risen. And I guarantee you their income has risen, but their retirement savings, to Mike's point, and their pensions haven't kept pace with what their income is today. And so I think that the what's out in front of all of us is having to re-educate people on, hey, you have to think about where do you want to be when you're 60 years old? And we've got to get to these folks when they're 22, 23, because the three-legged stool where you've got your Social Security, you've got, your pension, and then you've got your savings, I guarantee you there's, I heard a stat years ago. I don't know what the number is today. Mike might know it, but the average person had $50,000 in their 401k. Well, guess what? You'll blow through that the first or second year. What are you going to do after that? And so, we're working with people. We're trying to help them understand, when they've got access to a pension and a 401k, to make sure that they're putting money away and putting it away at the right levels. But I think that is something that all unions is going to have to work on, because we have a generation of people that just don't look at it the way past generations have looked at it.
It's true. And a lot of the points you made in there, we hear just through our working with retirees. Some of them are hey, 30 years ago, I didn't know the importance, but now I'm seeing it. And for their next generation of guys coming in, they're trying to enlighten and educate, that new generation, that the importance of that. But what I'll say, the benefits, Carl, even over the years, talking to some of your retirees, again, the benefits of a union and the benefits of your fund staff. I remember talking specifically to a retiree that was just confused about when he wanted to retire, dealing with Social Security, what his pension options were, survivorship for a spouse, and all those different things. To be able to go to your union or your fund staff and have the help and the resources there, it's just such a huge benefit for them. But on the flip side, like you're saying, again, making sure we're educating the new generation coming in is of grave importance. No doubt about that. Okay, so we are just past the mid-mark, everybody. Again, thank you for joining us. We're going to put up another poll question. This one's going to be geared a little bit more towards the Medicare population and healthcare benefits. But we're going to ask all of you guys, what group healthcare benefits are you currently providing for your retirees? And we have a few options here. We want to let you know this listing, you can select multiple options. So A, Medicare supplement. B, this is Medicare Advantage medical only. C is a Medicare Advantage plan paired up with a Part D drug plan. Or D is a Part D drug plan standalone. You can also select E, other, if there's something else you're doing. But we'd love to hear from you guys. And again, all responses are anonymous. So thank you for clicking through these, and we'll give everyone a few seconds. All right. Thank you, everyone. Okay, great feedback there. And those numbers are actually going to drive us into our next section. We want to talk a little bit about some myths and some misconceptions, specifically on Medicare Advantage. We feel like the market has a lot out there, and we want to dispel some of the myths there. And we're placed so strategically with working with our union partners, our public sector partners, our commercial partners. We're situated in such a great place to understand all of the different needs for every different group. No two groups out there providing benefits for the retirees have the same plan design, have the same network, or have the same needs. So, at RetireeFirst here, we're really situated in a place where we're able to see so many different plan options, how so many different groups are doing things. And some of the misconceptions, we see in the market that we continue to try to educate people on and make sure they're understanding things properly. I won't have a huge list, but I'll give you some of the top ones. We hear all the time about Medicare Advantage that it can't work for them because there's a small network, or there's always a network complication. And what we want to let everyone know is, and more specific to our group plans can be built on a multitude of different network platforms. So we typically, as an organization, we don't have any groups in a regional network. All of our groups are in what's called an open network, or a passive PPO network that basically ties itself to Medicare all across the US. So if a provider is accepting Medicare, they will most likely be accepting our Medicare Advantage plans. And it's one critical item to know, because a lot of people will just say Medicare Advantage isn't an option for me. Where we're located, our membership doesn't typically move after retirement, and we need to make sure that the providers are all here, or on the reverse, the retiree population does move out of the area and they head to Florida or warmer weather in Arizona or California, and we need to make sure that they have network available to them. So we hear it all the time, and we just want you guys to know that, we specialize in building these plans. But again, group Medicare Advantage plans can be built on a multitude of different network platforms that are based with Medicare and very similar to a Medicare supplement. So we wanted to touch on that. Next, I hit on it a little bit, but we hear all the time that all Medicare Advantage plans are the same. And again, we want to dispel of that myth a little bit. Our Medicare Advantage plans, and the majority of Medicare Advantage plans in the group space, they can be built in so many different ways. We have deductible options, copay options. There are so many elements of building out a Medicare Advantage plan that we are able to emulate any current benefits you might be administering today. And that's one of the pros of a Medicare Advantage plan, is that they actually cover more than Medicare in some examples. There are ancillary benefits that can be built into the Medicare Advantage plan. So I want everyone to be comfortable with that. And Medicare Advantage plans aren't a one size fits all. They are very customizable and can be built to your specific group's needs. And last, we just heard this one more recently, that Medicare Advantage doesn't cover everything Medicare covers. Again, I just kind of touched on in the last myth, but they are built. It is a Medicare plan, Medicare Advantage. They're built to have all of the same elements, resources. Again, we touched on networks, and we touched on some ancillary benefits like your silver sneakers and gym memberships. Some benefits like that are actually added into Advantage plans that you may not see in a Medicare supplement plan. So there's three quick high-level items and myths we wanted to dispel of there. And please reach out to us or ask some questions if you'd like to get clarified on anything else. But now we're going to get back to these guys on the panel. So, Carl, I'm coming back to you again. Sorry I'm picking on you, but we've had such a great relationship over a long period of time in working with you. And we know there's so much that you can enlighten and educate any of our attendees today. But I want to bring this home to us a little bit. Would you mind just sharing some of your experience in working with RetireeFirst, how our relationship has impacted your fund staff, and then most importantly, your retirees at the end of the day. But do you mind just, kind of enlightening everybody on what your experience has been with us specifically?
So that could take a while, but it's all been positive. So
Love that.
But everything that you talked about, Jan, is true. I mean, when we made this transition back 12, 13 years ago, whatever it was, we were in a traditional plan for our retirees, both pre-65 and post-65. And we knew that, changing from that traditional type plan that our retirees were used to a Medicare Advantage plan, we had concerns about disruption and, member access to their doctors and all those things. First year, I have to say, and let me go back a little bit. I mean, one of the things that our consultant was telling us, and then later RetireeFirst, was that, there was tools out there to help us control cost. Our plan had lost, I think we were over 120 million in assets. We were down a little over 40 million. A lot of the drain was the retiree healthcare, and we knew we needed to do something. But we didn't want to hurt our retirees, where you saw a lot of plans during that same time frame getting out of the retiree healthcare business. They just didn't offer it anymore. And so, working with RetireeFirst, we made this change, and we had a little bit of disruption. It wasn't from lack of doctors being in the network as much as for our participants finding their, getting to their doctor and getting, that transition from the MMO plan that they were in to the Humana benefit. I would tell you today, from a retiree perspective, they love what we've done with RetireeFirst and certainly their Humana benefit that they enjoy today. We still give them eye care. We still give them a hearing benefit. So they enjoy things today for basically $4 a month, because that's what our retirees pay per participant to have their post-65 healthcare coverage. And I made a point of getting out and talking to some retirees in preparation for today. And what they tell me is, before I turned 65, I was paying this, and now I'm paying a lot less. So not only am I paying less to get the benefit, but the plan that we have in place for our post-65 folks is better. And from a fund perspective, we always talk about return on investment. We're back over $100 million in assets. We have, about $10 million or more of gain share earmarked for our retirees that is come back through our contracts that RetireeFirst has been able to negotiate with Humana. I mean, we're just in a better place. And so when you talk about this 13-year or 14-year relationship that we've had with RetireeFirst, I can be hard to live with, and I'm not a big person about promoting, the folks that work for us. I probably should be better at it, but this has been a grand slam, probably one that the Phillies needed last night. And I'm sorry, it was just like the baseball thing came out, and anyway,
it hit me right here.
I'm sorry, but hey, your Arizona team's still in it, so you'll be all right. But at the end of the day, this has been great for the retiree and great for the fund. And we're able to offer a high level of benefit for a very, very extremely reasonable cost. And, in turn, when you're only paying $4 a month towards your health care, your pension is your pension. You're not sinking, paying $600-700 a month for some kind of Medicare supplement because Medicare is not paying your bills. Our retirees don't have that problem. So that's what this relationship has done for us.
Well, thank you for that. You know, we value our relationship all these years. But I just love hearing the feedback from the retirees. You know, that's what's most near and dear to our hearts. But hearing about your assets and the state of the fund, I mean, they're just all things that we love to hear. And I know Matt's team is eager to continue working with your retirees and making sure they're happy and healthy. So again, we value our partnership with your group, and thank you for that. So I think that's it for our questions. I want to personally thank Carl, Matt, and Mike. Guys, it's always good talking to you. Matt, thank you for what you're doing for our organization, but what you're also doing for our retirees out there. Mike, keep putting the information out there, the resources, everything you're doing is great. And Carl, one final thank you for our partnership again. We value all these years together. So Scott, I think we have some questions from the group. I can kick this over to you.
Great. Thank you, Gian. Thanks, everybody. Great, valuable insight. Carl, I was going to really compliment you, but you had to take the dig at the Phillies. So now I'm not so sure about that, but now terrific. Thank you all. Really valuable. Just a quick note. You can connect to the audience. You can connect on LinkedIn with Carl, with Mike, with Matt, with Gian. We just put up a quick slide showing their LinkedIn profile banners here. So feel free to connect, to network with them. They offer, great insight, and I'm sure they'd be happy to touch base with you separately offline. And again, if you had some colleagues that weren't on the webinar today, didn't get a chance to attend, please share the recording with them once we're finished, and I think they can get some great value out of that. So yes, thank you, Gian, for flagging the questions. We do have a couple audience questions here. The first question from our audience here, Carl, is for you. The audience member mentions or asks, we see so much bad press about Medicare Advantage. What has the feedback been from retirees about their benefits?
So I think I just answered that. I mean, the retiree experience has been phenomenal. Between our fund office and working with your staff at RetireeFirst, I know when a call comes in, and normally we get the call at our office. If we can't deal with it, we get a hold of, our folks at RetireeFirst, and from talking to our fund administrative manager and the staff, it gets resolved really quickly. So, the ability, our experience has been great. And like I said, members are not seeing huge balance billing and, and all the fears that people put out there. They're actually seeing that this Medicare Advantage plans are very helpful in serving their needs.
Great. Thanks, Carl. Appreciate that. Okay, we have another audience question here, which is for Mike. Mike, as a plan sponsor, what resources are out there that we can take advantage of?
Thanks, Scott, for that question. As we talk about financial programs or literacy or information, each plan sponsor has different contacts from investment consultants and advisors, but it's really working with your executive board and leadership, as well as the fund administrators, to proactively look at opportunities as a new member of the union when you're the younger generation, during, and then obviously post towards retirement, and looking to engage the financial advisors that are there. Some of the online tools that we made mention of, from the budgeting tools, the literacy programs, and some of these webinars and workshops, which in today's world now, as we're communicating, putting this webinar together, actively doing this on a more frequent basis to keep the members updated, engaged on how they can manage their money. And before, prior to this, this webinar too, and just doing my own research, government has so many resources and links that are free. Your central labor councils, organizations and guilds that collaborate with union organizations to create coalitions for financial literacy. One particular site and website that I thought and will be on, I guess, one of these links when we distribute this webinar, is the Financial Literacy Resource Directory from the Office of the Controller of Currency. So this is right from the OCC.gov, and it lists out information from financial planning and budgeting, even from security and Medicaid benefits and calculators. And I thought that was just a really great, it is on the ULA's hyperlink. And I believe in that everybody should have some of these hyperlinks onto their site from an educational standpoint, and actively work on promoting all these tools that are coming out, because technology is changing daily, and these benefits to be able to allocate and budget are there. It's just putting it into the members' hands and making sure that they're aware of it. And those are the tools I would recommend.
Great, thanks, Mike. Appreciate all the insight there on that.
Yep.
We also have another question here from the audience for you, Matt. So Matt, the question from the audience member here is, can you provide more detail about the house calls? You mentioned house calls, just some more specifics on how they work and how they benefit members.
Yeah, so that's actually one of those gaps in care as we were referencing earlier. And it really just is what it is. It's the old concept of a doctor or physician coming to your house. I think they've probably got an iPad in their bag now with their stethoscope and things like that, to make it a little more up to date. But these visits are really, really critical, and actually something that's gained a lot of traction across the country, really. And when you think about it, again, we just talked about dispelling myths. There's a lot of myths around these visits that, they're more for folks that are housebound or higher risk members that, can't get out of their home, things like that. Which, again, it's a great option for them because having the doctor come to your house solves that problem for you. But it's really for everyone. So also for healthy members that are wanting to see their doctor on a regular basis, maybe they don't have any chronic conditions, or maybe they're managing them all very effectively. These house calls are really, really unique and pretty effective. So it's really typically a 45 to 60-minute meeting with a physician. They're coming to your home again. And again, think about that annual wellness visit that I talked about. It's just an even enhancement on top of that. So you're talking about more focus on mental health, more focus on social well-being. I think what's really nice too and effective is that they take a look at your surrounding environment. So they'll check stair rails, carpet transitions, making sure there's no loose carpet, like things that could create a fall, for example. Like just making sure that the hallways are clear if you have a wheelchair or a walker they're using, like those sorts of things. Check your batteries and your smoke detector. So there's a lot of these things that maybe get put off or that you don't think about as an individual. These visits can help sort of bridge that gap. They're also great because, again, of the detail that they go into, a lot more can be uncovered from a chronic condition standpoint, or a lot more risks are uncovered. So therefore, you're staying ahead of those, right? Hopefully, right? Where I catch it early. That way you don't have to go on medication or have to start some costly treatments. If you're able to have those, things caught in an early fashion, that's going to help you and help your costs as well. And all the information there is shared with your team of doctors that you already have. So it really is a huge benefit to have this done, again, not just for those folks that are homebound or have transportation issues, but for everyone. These are one of the big things that we're promoting and talking about when our teams do outreach to members, to make sure that they're aware of these visits in particular, because they can be life-changing for a lot of people.
Terrific.
That's great points, Matt. Yep.
Absolutely. Yeah, I agree, Gene. Terrific, Matt. It's great insight. The house calls, I know, are things that that's a terrific member benefit that I really know is coming to more and more fruition as you and your team does all that proactive outreach that we talked about. So that's great. Thank you again. We do not have any more questions from the audience before we have a few minutes left. So if anybody in the audience has anything they want to ask, feel free to pop it into the enter a question box there. I also mentioned earlier that we've included links to various resources that we think you'll find helpful as a follow-up. So we wanted to list these out to you. And then when you have access to the recording after the webinar ends, those are live links there, so you can just click right in. The first is our website, RetireeFirst.com. We've got a lot of great content on there that we think you'll find valuable. We have client case studies, videos, blogs. We've got news updates and more, and we're constantly updating it with fresh content every week. So please check in regularly for new content there. One specific case study that we've included a link to is Cutting Costs, Not Care. And that highlights our collaboration with Carl in just some additional detail beyond what Carl gave. And we appreciate working, Carl, with you and your team on that. but it really talks more about how we collaborated with Carl, with his team at Cleveland Bakers and Teamsters to really help preserve retiree benefits and help them from a cost reduction standpoint, as Carl touched on. One other piece of content, something very new that we also worked on, Carl, and again, we appreciate your collaboration, you and Abby from your team, was a new video, just again showcasing how we've worked together, had a long collaborative relationship and friendship for the past 13 plus years, with you and the Cleveland Bakers and Teamsters family. So we think you'll all find that as a good tool. And then finally, we touched on all the work that Mike has done to develop the Union Labor Advisory Network website. So ULANetwork.com, excuse me. That's got all kinds of industry updates. Mike's got some great interviews, including one with you, Gian, I know, which was great from a few months ago. All kinds of videos with union leaders, with members, with corporate partners. A lot of great information about different types of union events and much more. It's really packed. And also the financial resources and links that Mike talked about, you can find on ULA Network, ULANetwork.com. I will get it right, Mike. Really terrific site. Please, everybody access that afterwards. If you have any questions after the webinar, and anything you might want to discuss about, some specific needs you have, questions you have about your group retiree benefits, please feel free to reach out to us. We're happy to learn more about your needs, your challenges, and speak with you on that and talk about some solutions that might be helpful for you. So you can, right in the book now button on your screen there, you can book an appointment. One of our advisors will get back to you. And that takes you to a contact us form on our website. So you can just fill out a few fields there. And if for whatever reason you have questions after the webinar, you can just go on RetireeFirst.com into the contact us page. And again, we'll be happy to have somebody reach out and, learn about your needs, your challenges, and talk to you more about how we can help. Lastly, we'd greatly appreciate it if you can complete just a real brief survey about the webinar here. We'd love your thoughts on whether the content was beneficial for you, and also what additional content you'd love for us to put out and help you with for future webinars. We've included the link to the survey on the screen there. So just want to again thank you, Carl, Mike, Matt, and Gian. Terrific webinar, great interactive discussion. Really appreciate your time. And for our audience, again, we know your time is valuable. So really wanted to thank you again for your attendance. And we look forward to seeing you on future webinars and future industry events as well. Thanks, everybody. Have a great day. Bye-bye.
Bye, guys.
Bye.